Drop is a small molecule drug for wet AMD. Wet AMD, the advanced form of macular degeneration, is the leading cause of blindness in the elderly and affects nearly 2 million patients in the U.S. The macula has several layers, including the Bruch's membrane, which separate it from the underlying blood-rich area called the choroid, and is the part of the eye needed for one's central vision. Central vision is needed for daily tasks such as reading, watching TV, or driving. AMD begins as the dry form, in which deposits of a material called drusen build up in the retina. Over time, the integrity of the Bruch's membrane can be compromised and it may rupture. New blood vessel growth, called angiogenesis, infiltrates from the choroid through the ruptured Bruch's membrane into the inner retina layers. These new blood vessels are thin-walled, fragile, and leaky, causing bleeding and fluid leakage within the retina, leading to the wet form of AMD. As fluid builds up, black spots appear in the center of one's field of vision and grow in size until vision may be totally occluded. Current treatments for wet AMD are drugs that target VEGF, a protein growth factor of angiogenesis, and require intravitreal injections, shots given directly into the eye every 4 to 8 weeks. This is an invasive and often expensive procedure, and is also inconvenient, since it needs to be given by a retina specialist in a clinic setting. Repeated intravitreal injections may also come with some inherent risks. Or Pharmaceuticals' new Squalomine eye drop is a small molecule drug for wet AMD. The drug, which is currently enrolling its Phase 2 clinical trial, can be administered conveniently through an eyedropper bottle. The proprietary formulation OR has developed was designed to diffuse from the front of the eye to the back, where the leaky blood vessels form, and for increased residence time once it gets there. The eye drop may provide several advantages over the current standards of care, including convenient self-administration of an eye drop instead of chronically administered injections directly into the eye. Squalomine not only inhibits the process of angiogenesis caused by VEGF, but that caused by other growth factors as well.